In this short video, we are going to discuss bunions. What they are, how they occur, and what you can do about them. Bunion essentially is the bump that occurs on the inside portion of the foot. They can occur on either foot or on both feet in varying degrees. Although poor-fitting shoes may aggravate a bunion, they do not necessarily cause their formation. The primary cause of bunion formation is due to the way the foot functions as well as the way a person walks. Abnormalities in function all the way up to the hips may adversely affect someone's gait, which will lead to bunion formation. Bunions tend to worsen over time. In most cases, bunions form secondary to feet that flatten out too much. This is known as excessive pronation. Not all bunions require treatment. For those that are painful, there are two types of bunion pain. First is joint pain. This is where the big toe hurts when you walk and the toe attempts to bend. The second type of pain is bump pain, where there is pain simply from pressure applied to the bump from the shoe. For most people, the pain they feel is bump pain. We have mentioned joint pain and we have mentioned bump pain as two causes of bunion pain, but there can be a third source, a bursitis. Pressure from the bony bump against a shoe may cause the formation of a bursitis. It usually presents as a red, possibly spongy area over the bunion bump. Treatment of bunions. The first thing is to try wearing more conservative shoes. Wider toe box, softer material so there's less pressure against the bunion, and of course a lower heel shoe. If you only have occasional pain from your bunion, there is certainly nothing wrong with taking anti-inflammatory medication such as Advil, Aleve, or Motrin. Keep in mind this type of medication is not a cure for bunion pain and should not be taken on a regular basis, particularly in those who suffer from high blood pressure or who have kidney disease. They may also upset your stomach and are very dangerous in the elderly. You can try pain-relieving gels and creams on the bunion area as well. At best, you will get temporary relief. When your bunion pain won't respond to conservative treatment, it is time to see the doctor. It is best to consult with a doctor who specializes in the care of the foot. He or she should be able to offer both non-surgical and surgical options. Sometimes, cortisone injection can be very helpful. Physical therapy over a period of a few weeks using different modalities to reduce inflammation may also be helpful. If your doctor determines excessive pronation is part of your problem, then an orthotic may be recommended. An orthotic attempts to reduce pronation and thus reduce the forces causing the bunion to worsen. An orthotic also better aligns the big toe joint and in doing so reduces a painful joint. An orthotic will not reduce the size of an already existing bunion. If you have tried the previously mentioned treatments and your bunion hurts on a regular basis and perhaps is even worsening, then it is time to consider surgical correction. This is not a decision that should be taken lightly, as there is a significant sacrifice to be made during the healing process. Not all bunions are the same, so the procedure your friend or your mother had performed may not be the same for you. When we evaluate a bunion for surgery, the type of procedure performed depends on a number of factors, including patient age, patient activity level, and patient occupation, as well as X-ray evaluation. We measure the angle formed between the yellow and red line, as well as the angle between the yellow and green line. In general, the larger the angles, the greater the amount of surgery that will be required to correct the bunion. Goal in bunion surgery is to reduce excessively large angles to a more normal range in order to get better alignment at the level of the joint. We also take a look at the quality of the joint itself. If the joint is deemed excessively arthritic, the joint will have to be addressed either through remodeling by removing the bone spurs around the joint, or insertion of an artificial joint, known as an implant. Bunion surgery recovery time. Recovery time will vary from person to person. It is dependent on a number of factors, including the actual procedure performed. The more involved the procedure, the longer it will take to heal. Patient age, overall patient health, a smoker versus non-smoker, normal weight versus overweight. Gone are the days of sitting with your foot elevated for 6 weeks while your bunion heals. The goal is to get the patient up and moving as soon as possible. In most cases, you can walk on the foot almost immediately. In some cases, you will have to be non-weight bearing for upwards of 6 weeks. Your ability to return to all your normal activities will vary. Speak to your surgeon about the specifics regarding your case. In general, most people are 75 to 80% improved in 3 to 4 months, with the remaining improvement occurring upwards of 1 year. As stated earlier, every individual surgery is unique and there could be many variables before the foot is totally healed.